Hello everyone, it's Daria from Home of Hope. I'm the administrative assistant, and today I will be talking to you about how chemotherapy can affect your feet. I want to preface this with I am not a medical professional. This is all just simply research that I have done. If you have absolutely any questions about your feet care, please contact your oncologist or your primary care doctor. Foot care. Caring for your feet while you have cancer can be a very difficult task to manage sometimes. You may notice foot pain, numbness, or other issues that cause discomfort and problems if you leave it unattended. If chemotherapy is a part of your cancer treatment regime, please be aware that there may be conditions that affect your feet. With that, let's discuss hand-foot syndrome and chemotherapy-induced peripheral neuropathy, or CIPN. Hand-foot syndrome that usually manifests as a redness, swelling, and pain of the palms or the hands and the soles of the feet. It can be accompanied by blisters, peeling of the skin, and rashes. It may also occur in other areas like your knees or your elbows. If you have any symptoms, you may notice redness, often accompanied by swelling, a rash, blisters or calluses on the soles of the feet or on the palms of the hands. You may notice difficulty walking due to foot pain or difficulty in manual tasks due to the pain in the hands. There's also burning or tingling sensations, which can also be a symptom of neuropathy or nerve damage. There's soreness or tenderness, or in severe cases, significant pain, 9 or 10 on a pain scale, may be present. The skin of the feet may be dry or cracked. Just a disclaimer, if you are undergoing chemotherapy, and have these symptoms, it does not always mean that you are experiencing hand-foot syndrome. You may need to consult your physician, a podiatrist, or a foot health professional to determine the origin of your pain or discomfort and to receive appropriate treatment. With that, the causes of hand-foot syndrome. There's various classes of drugs used in chemotherapy for treatments of breast and other types of cancers that can cause hand-foot syndrome. When chemotherapy drugs leak into your healthy cells in the soles of your feet or the palms of your hands, they cause damage. At that point, symptoms may be triggered even by pressure and friction from normal walking and standing, as well as normal use of your hands. Prevention and treatment. It can be difficult to prevent because it's caused by potentially life-saving cancer therapy. In your severe cases, chemotherapy treatments may be suspended or your dosages may be lowered. Medications such as ibuprofen, naproxen, or over-the-counter remedies may be prescribed. Topical creams that contain anesthetic ingredients may be used to reduce pain in your palms and on the soles of your feet. Ice packs applied to the areas of the hands and feet where swelling occur. Moisturizing creams and topical treatments can help with the dry skin and peeling. Padded socks and cushioned or accommodated footwear can help reduce pressure on the feet. Using hand tools as little as possible to avoid further inflammation. Avoiding extended exposure to heat or hot water on your hands and your feet. And taking frequent breaks from exercise to take pressure off your feet. You don't want to overexert yourself or your hands or your feet if you're feeling the pain. Medical considerations. One of primary concerns with hand-foot syndrome is the potential infection or peeling of cracking skin and open sores. Use antibiotic creams and cover any open wounds or exposed areas with bandages. Over-the-counter burn pads and bandages may be able to work as well. If any indication of infection occurs, please consult your primary care doctor immediately. Common signs of infection are redness and swelling around a sore, a warm feeling when touched, the presence of pus, and sometimes red streaks in the area around the sore. If you suspect that you have hand-foot syndrome as a result of your chemotherapy, and especially if you have a discomfort pain and your interference with your ability to walk and or use your hands normally, please consult your oncologist, your primary care doctor, or your podiatrist. With chemotherapy-induced peripheral neuropathy, or CIPN, peripheral neuropathy is a damage to your nerves in the area of your body outside your central nervous system, which is your brain and your spinal cord. It mainly affects your hands and feet, often causing a numbness or burning pain and weakness in muscles affecting your ability to function normally and comfortably. Extended numbness and lack of sensation in the feet with unrecognized trauma can be a great danger. The symptoms of CIPN. You'll notice a lack of sensation, a tingling or burning pain through the feet and the toes, just like with the hand and foot syndrome, and a difficulty keeping balance or walking. Most symptoms tend to start in the feet, and over time they may occur in other parts of the body as well. Most times, CIPN will tend to start farthest away from the head and move closer in time. So you may notice it starts in the hands and feet, but it can spread. You may notice a sensitivity to cold or heat, a muscle weakness, some difficulty swallowing, changes in your blood pressure, constipation, and difficulty passing urine. If you're experiencing any of these symptoms while undergoing chemotherapy treatments, do not just assume that they are strictly the neuropathy though. If you have any of these symptoms, please contact your oncologist or your primary care doctor. Treatment options. If you're having any issues with CIPN and you've consulted your physicians, they may recommend these few treatments. Reducing the dosage of your chemotherapy drug they might change your treatment regimen completely. Prescription drugs to treat symptoms of pain and discomfort. Non-pain drug management options, physical therapy, relaxation therapy, meditation, electrical nerve stimulation, massage, things like that. Proper footwear is very important to prevent pain and from pressure and unrecognized trauma when sensation is lost. This may include padded socks and fitted footwear. Medical considerations. CIPN may last for a limited amount of time, or it may be a long-term issue, depending on your age, your other medical conditions, i.e. if you have diabetes or anything like that, your other medications that you take, and the type of dosage and frequency of chemotherapy treatments. Exercise may be beneficial as well, and if you need any exercise tips that we also go over on neuropathy, you may check out our Matter of Balance Wellness Wednesday video. Please always consult your physicians before starting a new workout regimen though. Chemotherapy drugs are effective because they are killing the fast-growing cancer cells. However, since they circulate through the body, they may affect normally functioning healthy cells as well. Not everyone will be affected by these side effects, and they can vary in severity. The most effective way to deal with side effects like hand-foot syndrome and CIPN is to consult your team of physicians and to take proper steps to address any symptoms that may occur. And as always, HomoFoc is always here to help. We're just a phone call away, or you can stop in. We're always here. We do offer massages. We offer yoga. We're getting our programs like this for the Wellness Wednesdays. So if you have absolutely any calls or any questions, please give us a call. We are always here. Our phone number is 815-288-4673. And again, I'm not a medical professional. This is all just research I've had. If you have absolutely any questions about hand-foot syndrome or the chemo-induced peripheral neuropathy, please contact your physicians. Thank you so much and have a wonderful day.